Right, so in this session we're going to teach you about performing CPR correctly on a patient in cardiac arrest and how to maintain their airway and ventilate them. We've set up this mannequin so they are in full cardiac arrest. The defibrillation pads have been attached, so we're just going to carry on from there really. Okay, so when I will go through the CPR with you, the chest compressions, and we will do the airway and the ventilation. Okay?
Okay, so the key thing for us, we're going to be concentrating on doing the chest compressions.
Right.
Okay, so hand position is really important, and how much depth we're going to give to each compression, what speed we're going to do the compressions at as well. So all of those aspects are really important, because the purpose of what we're trying to do is maintain circulation around the body until help arrives, and then until we can treat whatever the cause of this cardiac arrest is. Okay, so we've got the defib set up, as Andy said. So what we're going to do now is just look at the chest. Okay, so we're going to split the chest in half, and then we're going for the bottom half.
Right.
Okay, so it's one hand on top of the other. Interlock them like that, whatever's comfy really, but that tends to be better because we're going to get hot and sweaty, so better control. And that weight is going to come through the heel of the hands. Okay, so when we're in position, lock the elbows, and then try and be over the patient. So the weight is coming through your shoulders, and your back is straight. Because what a lot of people do, if you're doing that the whole time, your back is curved, you're going to get tired very quickly. And potentially, if there were only two of us, we're going to be doing compressions for a long time until the team arrive.
Okay.
So we need to maintain good quality compressions the entire time. Okay, so we split the chest, and we're going here, and then we're going to press down about 5 to 6 centimetres, and we're going to do 30 compressions to 2 breaths at a rate of about 100 per minute. Okay, so that is quite quick. So it's 1, 2, 3, 4, 5, 6, 7, 8, 9. And it's useful to count out loud while you're doing it.
Okay.
So when it comes to 27, 28, 29, 30, those doing the breaths are in position ready to go. Because what we want is minimal delay between the compressions and the airway and the breaths. Okay?
Makes sense, yeah.
Okay.
Okay. So, right, for the airway, again, important that we keep the patient oxygenated. So these are the pieces of equipment we use. Mask that fits the patient, quite easy to fit it. It should fit over the face, shouldn't overhang the chin, and there should be no significant leaks around by the eyes either. Okay, so you need to fit it and put it on the right way as well. A lot of people do put them on the wrong way. It's quite easy, that's a pointy bit, the nose is the same, so that goes over the nose. Okay. The self-inflating bag, you can use these very useful pieces of equipment. You can use them without an oxygen supply or with an oxygen supply. In a cardiac arrest situation where there is an oxygen supply, you always connect it up and run it at 15 litres a minute, even if the patient has got a respiratory condition. And maintaining an airway is one of the most important things is positioning the patient correctly. Okay, you can make it difficult for yourself, or you can make it easy. The easiest way is to keep one pillow under the patient. I often found that people would rip the pillows out, making it very difficult. So keep one pillow under the patient, roll it under the neck so that the head extends with gravity. Because what position is best to maintain an airway?
With the chin forward.
Yep, that's it. So that gravity does that a little bit for you. You might have to help it along a little bit. But pop the mask over the patient's face. 2 fingers. The angle of the jaw, right here, just by the ears, because you want to lift that mandible up, both sides. So your hands are more or less vertical, and the heel of your hands go on the hard bit of the mask. Okay.
Yeah.
Don't touch this gasket.
Right.
Okay, and make sure these fingers aren't touching any soft tissues. Okay, all of that will hinder your ability to maintain this airway. So, I'll just show you. So the movement you're doing is you're pulling the head back, you're lifting the mandible up, and you're squeezing the mask down. So you're doing that kind of movement. Okay. It is quite a physical movement, so don't worry about hurting the patient. It's very important that the airway is maintained. Okay, so there we go. I'm happy. Give that a squeeze. And it's just enough for a chest raise.
Yeah.
You see that? So you don't need to use the whole bag. Yeah?
Okay.
Okay, you happy? You want to go with that again? That's it. Okay. So,
Thank you.
You have a go with that. The mask. Tell me when you're happy.
Yep, happy
Yep.
there.
Squeeze. And that's when you know you've got a decent airway. You can see the chest rise quite easily. There's not a great deal of effort in squeezing the bag. Yeah, and there's no noises coming from the airway either.
Fab. Okay.
What kind of noises do you think you'd get from an airway as you ventilate it? The patients, you know, they lost consciousness before they went into a cardiac arrest. What could have happened?
In terms of the tongue could have gone back to the throat.
Okay. Yeah.
Which would have stopped them then breathing.
Yeah.
So it would have been an obstruction.
Yeah. Good. So by lifting the mandible up, you're pulling that out of the way.
Mm-hmm.
What else do you think can gather in the airway?
Secretion.
Secretions. Okay.
Yeah.
So that's why we have this here. Okay. Should always be at hand, available and working.
Okay.
In clinical areas. So when you do have a cardiac arrest, use this piece of equipment, Yankoseko resuction. And what you need to do is check the airway and clear any secretions that you see. Okay? And just clear where you can see. Don't push this too far back.
Okay.
Cause trauma to the airway and then
No problem.
a nightmare. Okay? You
Fab.
good?
Thank you.
You can put it all together now if you want. Girls? Yeah?
Okay.
Yeah.
Yeah?
Yeah.
You can see that just with two of you can run the cardiac arrest.
Just
in the
keep
first
that on your
stages.
arm, is it? Yeah.
Make sure this is straight on. Okay? There you
Okay.
go.
Okay, so do you
Okay.
want to get into position with your
Yeah.
hands?
Get yourself in a comfortable
That's it,
position
one
so
on
you're
top of the
directly
other.
behind
Yeah.
the patient.
Weight coming through here,
Save your
elbows locked, weight through your shoulders, and then how far down? Do you remember what we said? How far down?
About 5 to 6 centimetres.
That's it.
Yeah.
There we are. So do you want to have a couple of goes, because it'll take you a couple of tries to get the feel for how much pressure you need to apply.
Yeah.
That's
all
it.
about right.
So a little bit further down. That's it. And that's about the speed. So that's it. Just keep
Okay.
these locked,
Yeah.
and then we're going to do 30 of those.
Okay.
So should we do 130 with 2 breaths, and then we can
Yep.
put the defib and things
Yep.
on then? Yeah?
Okay.
Okay.
Shock advised. Charging. Stay clear of patient. Deliver shock now. Press
Okay,
the orange
everyone
button
clear?
now.
Yeah, oxygen clear.
Yeah.
Okay.
Shock delivered.
Back on the
Pause.
chest, please.
Start CPR.
That's it. So interlock one hand on top of the other. That's fine.
Okay.
Yeah. And your hand is located about a third down in the chest. That's fine.
Okay, so you want to make sure that
So
you...
what speed are you going now?
26, 27, 28, 29, 30.
So if you want to just place the mask on the patient's face so you can see that you can do that. Lovely. Okay, so put your heels with the hands, that's it. Both fingers at the angle of the jaw. Happy?
Yeah.
2 breaths. Back on the chest.
Okay, back on the chest. So what speed are you
You
doing
hold
this
on to
now?
that. Keep
100
that
beats
there
per
with you.
minute.
Okay, and how many compressions to how many breaths then?
30.
Okay. That's it. So keep your elbows locked, and then the weight is all coming through your shoulders. You feeling
78,
okay?
29, 30. Yeah, I'm fine, thank you.
Back up. Back on the chest.
Okay, so back on. That's it.
Okay, so all you're doing is holding this airway open and the flow of oxygen will provide the patient with some oxygen, okay?
No problem. 24, 25, 26, 30.
Back on the chest again.
That's it. So your hands comfortable like that?
5, 6.
Yeah. That's it. So keep your elbows straight. That's it.
All right.
Yeah, that's fine. And then your back is straight, so you can keep going longer then.
Good. Keeping this
That's
airway
it.
open. Well done.
Should the bag be on the side or does it matter?
Doesn't matter where it is, it's fine as long as somebody can reach it. Make sure this is a 2-person
20,
technique.
21,
So,
22, 23, 29, 30.
so you always maintain that.
That's fine. Whatever is comfortable for you, really.
Okay.
That's fine. So back
Go
on.
back on.
So how far down on the chest are you going?
About 5 centimetres.
That's it.
Yeah.
That's it. And keep your elbows straight. That's it.
27, 28, 29.
Easy. It's easier. You tilt the head back.
Yeah, it is.
Stop CPR.
So do you want to press it
Analyzing
this
heart
time?
rhythm.
Yeah.
Okay, we'll see what it says now.
Stay clear of patient.
So the oxygen's away?
Everyone
Yeah.
clear?
Analyzing
Yeah.
heart rhythm. No shock advised.